Hi, I'm Holly Wall. I'm a board certified plastic surgeon here at the Wall Center for Plastic Surgery. I've been in practice a long time, 22 and a half years. I trained at Stanford and I specialize in all aesthetic procedures for women. We're going to be talking about labiaplasty. It's one of the procedures that plastic surgeons do that's really increased in popularity. And what we're talking about are the lady lips downstairs, not these lips. What I'm addressing when I do a labiaplasty is the labia minora. Those are the inner lips. And it's become more of a topic because it's an area that can't be addressed with diet or exercise. It's usually congenital. Sometimes it's related to hormones or difficult deliveries, but we've come to be more aware of it because our grooming practices are different. People shave a lot more. The area is more visible. We wear a lot of tight clothes, like exercise clothes for normal attire now. When you work out, when you're wearing a swimsuit, it can be noticeable because our clothes are so much tighter. So labiaplasty, it's not that any of the area is abnormal. It just may not be how you want it to look. It's not unlike breast surgery. Your breasts are functional, but they may be asymmetrical. They may be too small. They may be too long. And we address that because diet and exercise won't fix that. Labiaplasty is a very straightforward procedure for me. It's the recovery that can be a little bit more of a challenge. The labia, it's very fragile tissue. It's a lot like the inside of your mouth. And if you think about how if you bite the inside of your mouth, it's inflamed, it takes a while to heal, it's very fragile tissue. So the surgery is straightforward. It's really not painful at all. You just keep ice on the area for about 48 hours. But it's being very careful for 6 weeks because we don't have maximum strength of the repair for about 6 weeks. So for 6 weeks, no baths. You just don't want to sit and soak too long. No scissor exercises like running, obviously not riding bikes, kind of common sense things. Walking, in your daily life is normal, but walking for exercise, you want to avoid that. Scissor exercises, too tight of clothes, no jeans, no yoga pants. You want to wear loose things and no intercourse for 6 weeks. We want to let that area heal. It heals beautifully. It's essentially scarless surgery. So everyone is very pleased. You do want to see a board certified plastic surgeon because there are a lot of nuances to this surgery. To have essentially scarless surgery, it has to be done perfectly. We want the curve to be perfect. We want to reduce the labia to be the same length or a little shorter than the outer lips. And one thing that people often don't talk about is the distal color of the labia minora, the inner lips, can often be a different color. We want to make sure that that's all removed. I don't show before and after pictures of labiaplasty. It's all over the internet. We will have a thorough discussion of this in a consultation. If you're interested, please call the Wall Center for Plastic Surgery, 318-795-0801, or check out our website, wallcenter.com.